talk about diaphragmatic breathing today. So most people actually use a quote-unquote wrong breathing pattern, and we tend to be more of a upper chest breather. So that means when you take a deep breath, you're breathing more in through your upper rib cage, your chest, your shoulders rise up. So Felicia, if you want to try a couple of breaths like that. So you'll see her chest is rising quite a bit there. She's starting to shrug her shoulders a little bit. So most people actually have that kind of breathing pattern, but what we want to be using is our diaphragm. So our diaphragm is this big muscle that sits on the underside of our rib cage. It's a domed shape of muscle that sits on that part of your rib cage, and it is our primary breathing muscle. And the reason that that's so important is because it's actually a much more effective breathing pattern when you're using your diaphragm, as well as it helps stimulate your vagus nerve, which that is your parasympathetic nervous system, which means that it helps you with rest and digest. It's the opposite of like your fight or flight mode. So that is why using diaphragmatic breathing can be really helpful for relaxation and pain management, because it helps to stimulate that nerve and helps your body calm down. So a couple of cues for diaphragmatic breathing is I'll have people put their hands just on the lower part of their rib cage. So you're just going to keep your hands nice and relaxed there. And then Alicia, go ahead and just take a nice deep breath in, focusing on expanding where your hands are at, and then breathe out and just relax. So breathing out is actually a passive movement. So the active movement, meaning that the muscles are contracting, are that breathing in movement. When we exhale, everything is actually more relaxed. So it's just that recoil of the muscle. We're not actually having to actively activate any muscle when we breathe out, unless you are very forcefully breathing out. So a lot of times people will give you a cue of breathe into the belly. And that's not the worst cue, but there's better cues, because sometimes when you just breathe into your belly, you're just getting that part that's more through the front of the rib cage, and you're not getting that expansion through the back and the sides of the rib cage. So go ahead and just really focus on keeping that breath out through the rib cage, and breathe out. And if you'll notice, when you work on diaphragmatic breathing, you can actually try to get your breath to go into different areas of your lungs. You can focus on, you might see one side that doesn't move as much versus the other side, and if you really focus, you can kind of direct that air to that spot that's not moving. Another thing that I see fairly often is that you'll get that diaphragm moving, but then you'll also start to hinge your back. So see how her back lifted a little bit off the table. So she did get that nice expansion, but then she was moving her back too much. So this should be a nice relaxed position. It's easiest laying like this. This is called a hook lying position. It puts your back in more of a neutral position. Take 5 minutes, just focus on breathing, using that diaphragm. You'll find you're quite a bit relaxed afterward. Any questions, direct them to Anchor Wellness Center. Thanks, guys.